Domestic violence is a pattern of abusive behavior in any relationship that's used by one partner to gain or maintain power and control over another intimate partner. Now, domestic violence can be physical, sexual, emotional, psychological, or any other threat or action of coercive behavior. That includes things like intimidation, isolation, or manipulation. And the statistics around domestic violence in the United States are staggering. The National Coalition Against Domestic Violence says, on average, nearly 20 people per minute are physically abused by an intimate partner. During 1 year, this equates to more than 10 million women and men. This is often seen as a women's issue, as numbers show 1 in 4 experience domestic violence. But men are affected too, with 1 in 9 experiencing it. And transgender individuals face unique vulnerabilities. A study by the American Public Health Association found trans people were 1.7 times more likely to experience intimate partner violence than cisgendered people. All this to say, domestic violence is a huge issue in our society, and in our Kent County community, it's reaching new heights. Between 2021 and 2022, the number of domestic violence homicides in the county nearly doubled, and prevention leaders say the overall severeness of domestic violence incidents are getting worse. Now, there is hope that the justice system can change this by somewhat changing the justice system itself. Let's take a look at these efforts. On a typical day, more than 20,000 calls are placed to domestic violence hotlines nationwide. But not all days are typical, especially during a global pandemic, when billions are shuttered inside their homes. And according to the National Commission on COVID-19 and Criminal Justice, the United States saw just over an 8% increase in domestic violence cases following the 2020 lockdown. 1 year later, the state of Michigan reported more than 70,500 incidents, and in areas like Kent County, rates and severity of abuse continue to spike.
We are finding these alarming data points. You know, it feels almost to cheapen it sometimes to talk about human life in the terms of data, but the reality is that more and more people are being killed by their intimate partner, and it's not a trend that, you know, we wanted to sit back passively and hope that things would look different.
Tara Ade serves as the co-chair of Kent County's Domestic Violence Community Coordinated Response Team, or DVCCRT. Comprised of more than 20 organizations, the collaboration has worked for decades to prevent and respond to intimate partner violence.
One of the things that I can recall in the DVCCRT's history is helping to streamline and quicken the personal protection order process here in Kent County. That was well before my time, but I know the work that was done there was largely a response to how long it was taking victims of domestic violence to have their PPO heard by a judge. I think in large part because of how much control abusers can have over the lives of victims, having a community-based response is quite literally life-saving for victims and survivors of abuse.
Last year, the DVCCRT partnered with the Kent County Prosecutor's Office to track domestic violence homicides within the region, something the state of Michigan doesn't have a consistent system for.
It's extremely difficult to do, and because we have a homicide code. So I have to go through by hand to say, okay, was this a domestic?
The study found homicide rates nearly doubled between 2021 and 2022. And when asked in early months of this year, Prosecutor Christopher Becker said numbers still weren't showing improvement.
It was 2021. I think the last 4 homicides were all domestic violence related, and last year we had a number once again. And it wasn't just, the man killing the woman, it was ex-boyfriend killing current boyfriend, or boyfriend killing ex-boyfriend. That's still domestic violence, and the woman's in the middle of this, that impacts them.
But even these staggering statistics don't account for all domestic homicides in the county. Ade and Becker say gaps within the justice system can make these cases difficult to track.
Those often don't get counted in domestic violence numbers because if the abuser also kills themselves, there isn't a case to be brought before a judge.
because it was a murder-suicide. He killed his, child, and then he killed himself, and that was, we don't see it because there's nobody to prosecute. And there's nothing for us to review, so it doesn't go into any of our stats, and that's pretty much true across the state.
Local prevention and response tactics are well and alive in West Michigan, and nationally, advocates have seen movement, with some of the most sweeping gun legislation in decades passing last year, targeting domestic violence. But the funds to do this work have been fairly low. That's why today, the DVCCRT says it's in a life-changing position.
The DVCCRT met 2 weeks ago, and just as a standing agenda item, we do a budget update, and it was this really neat experience to be able to say, yep, our current balance of our budget is just over $1,000, and now having received ARPA funding, it's a lot more zeros.
The group took a unique approach last year, applying for American Rescue Plan Act dollars to bring a court specializing in domestic violence cases to the area. While the group didn't receive the $10 million they requested, the project was greenlit for $4 million.
It's cool, all of a sudden, nobody's ever said, oh wow, $4 million, that's bad to see $4 million in your bank account. But there is some pressure. I mean, we don't want to whittle it away.
The court would bring additional support to survivors, breaking down the barriers to justice many face.
For example, if somebody doesn't have a lot of economic mobility, meaning access to resources, a well-paying job, a strong community support system, a strong family or friend support system, all of those things kind of can start to pile up on one another and create barriers and challenges that a lot of times results in victims literally not being able to leave, or they take that risk in leaving and unfortunately experience severe violence up to, unfortunately, even sometimes homicide.
I think that's the biggest problem we have as law enforcement, is that when a woman, generally it's a woman that is abused, they call the police, they're very on board the night up. They've just gotten beat up, they got a black eye, they get injuries, they're very emotional, he gets shipped off to jail, but all of a sudden the next day they're trying to deal with, okay, what do I do with the kids? I got to go to work. He was my daycare provider, or he was the financial, and now he can't work, and now how are they going to pay the bills? Whatever it may be. So it's the support to the victim and trying to get to them early. The quicker we can get those supports into the victim and say, hey, we've got ways to help, and that's part of what this court will do.
The court aims to center the victim or survivor, creating a sphere of protection within the justice arena, an area that doesn't always feel safe to step into. But simultaneously, it's also about holding perpetrators accountable.
And hopefully, get the abuser engaged in their own intervention services, like a batter intervention program, to support them in, if they're willing to do that hard work, change their behaviors and change the way that they treat, people they're in relationships with.
While excitement around the project is high, Becker says there's still a lot of work to do before it can become a reality, like staffing and budgeting, though he is hopeful the court will sprout up by the end of this year.
Do we do 2 judges? I mean, there's a lot of treatment courts that have, you got, Grand Rapids has got a lot of cases, and then we have another judge that takes the cases that aren't in Grand Rapids. Can we do something like that with the money we have? I would hope we could.
The team is committed to discussions with the community to find out what support services will be most impactful for survivors and the future. They say it's not a project that will be built in a day, but once up and running, the court has a potential to save lives.
We knew we needed to do something different. We needed to do something transformational. And so this ARPA funding quite literally is this once-in-a-lifetime opportunity, not just to be able to dream about what could be, but actually say, okay, now we have the means and the mechanisms to actually bring it to fruition, which is really exciting. I don't know if the timing could be more perfect, given what we're experiencing as a community.